I'm excited that you're here because what he said on that day has to do with business and people being exploited. He feels that a whole lot has been stopped in other parts of the world, talking about organ transplantation and how you can actually get them. So the new market now is in the country Nigeria, and the government is trying to bring up this particular bill into law to help them create market. Maybe let's start
No,
looking at some
okay,
of...
in the first
Yeah.
instance, I did send a message that the bill that he quoted for you people was the wrong bill. A bill in the draft form as it was in the Sixth Senate, not the bill that we considered in the Senate and passed. So he was quoting something entirely wrong. But I expect that having been at the public hearing, he was there when we took a consensus opinion. Possibly he didn't listen. But somebody at that level should actually be current with what he comes to discuss.
Can you explain to us, for instance, let's look at some sections. Let's
Yes,
go to
okay.
52.1,
Yeah, go ahead.
and it says, only a registered medical practitioner or dentist may remove any tissue from a living person. Use tissue so removed for any of the purposes stated in this bill, or transplant tissue so removed into another living person.
Yeah.
So what's the definition when you say only a registered medical practitioner or dentist?
Yeah, okay, let's assume now somebody has an injury. We want to assume somebody has an injury, and you're going to probably take a part of the skin to cover up for something, somebody else. It's only a doctor who is trained in that field that should be able to remove that tissue to probably replace some, like people who have burns. Probably have a burn and they have to cover an essential part of the body. You have to take tissue, which is the skin this time, from one place to the other. Or let's assume that possibly in the course of time, somebody has a renal failure and you're going to have to take kidney from a relation after a cross-match to save the life of another, because one kidney can make you functional. So only somebody who is trained in that field will have to take that tissue and be able to transplant it into another person. Or a dentist probably is going to have to remove the tooth of somebody. It's only a dentist who is qualified that should be able to do such. That is what this law is saying, because at the moment, people just do it anyhow.
Does it take care of your consent?
Yeah, of course, the consent clause, everything. That nobody can take anything from you without your consent. I think it is provided along the line, in the issue of transplants.
So when we
Because
talk about
in 52, there's only sub 1 and 2, and they didn't talk about consent.
No, only a register. That is the issue is about the remover, that it goes there now. Then you move into the consent law. I think
because before, as we look out for that, because going further to 53.1, we're trying to look at some offenses here for a person where they said it is an offense for a person who has donated tissue, blood, or a blood product to receive any form of financial or other reward for such donation, except for the reimbursement of reasonable costs incurred by him or her to provide such donation. So we've always heard about, someone trying to sell some of these tissues. Is this what this section
That's
is trying to
exactly
stop?
the import of that section, because we don't want Nigerians beginning to sell their tissue or to sell their organ. So that's why we've had to making the law trying to restrict Nigerians from wanting to ask for money in order to sell their organs, because we know that these kind of things happen in some countries. I don't want to mention a specific country, but it happens somewhere in the world where people actually come out to donate their kidneys for money. We want to be able to avoid such in Nigeria. It should be that if you want to help somebody, let it be something that is willful and not for the purpose of any pecuniary gain.
And I was wondering if that wouldn't amount to actually jeopardizing the health situation of the recipient in a case where you don't have a voluntary donor and you have someone who is willing to sell a part, and you say this law prohibits that person.
I don't think that it's right to sell any part of your body. Anybody who is willing, it should be a willful donation. Because if you don't prohibit it, so many Nigerians are poor at the moment. Before you know it, without caring about the health consequences that may come up later, without caring about their own situation of health, you'll be surprised that people sell any part of their body just to make money.
So how come the surgery or the whole process, the procedure is that expensive? Because people would have thought that part of the expenses is procurement of that body organ.
Actually, it's not that. Like if you're doing a kidney transplant at the moment, there's a lot that is involved in the process of transplantation. It's not just about removing a kidney from somebody and just dumping it in somebody else. It's not that. It goes beyond that. The preservation process is there, the preparatory process is there, but the medications thereafter to ensure that you don't have a rejection of that organ or the kidney or any other organ that you donate. The medications that you take that have to be given to you in the next several months is quite expensive. That is actually where the cost is. The cost is not usually as a result of the organ transplantation.
Okay, my colleague asked you a question about the permission of the individual, the donor or the donee, as the case may be. But in section 51, it talks about a person shall not remove tissue from a living person for transplantation in another living person or carry out the transplant in a hospital authorized for that purpose and on the written authority of the medical practitioner in charge of the clinical services in that hospital, or any other medical practitioner authorized by him or her. In the case there is no medical practitioner in charge of the clinical at that hospital, a medical practitioner authorized thereto by the person in charge of the hospital. Now, in all of this, from section 51, 52, 53, even up to 54, there's nothing
Can you
there.
come back to section 48?
Because these were some of the
I'm
things.
coming.
These were
That's
some
why
of
I
the
said- that's why I'm
allegations
just trying to
that were
draw you,
raised.
yes, I'm
Okay,
just trying to draw
let's
you
go
back.
back. Yes.
Section 48 says, subject to the provisions of section 53, a person shall not remove tissue, blood or blood products from the body of another living person for any purpose except A, with the informed consent of the person from whom the tissue, blood or blood product is removed, granted in a prescribed manner.
What is
That's
the prescribed manner?
No, a prescribed manner that there must be a process. It may be totally in writing, it may be specific indications, and further in this bill, for anything you're going to carry out on any human being, a user must be properly informed of every situation before you actually go on to do it. You cannot leave the Nigerian uninformed about whatever procedure you want to do. So that now means, in a prescribed manner means there must be a further regulation going along clause 49 that creates the process, further process, because everything cannot be contained in this parent bill. That's why it allows for regulation, but it states very clearly that a person shall not, that means shall is compulsory, shall not, once you see the word used in the law, shall is compulsory, without the informed consent. So the person who is going to, the donor must be properly informed. That's why the use of the language informed, and must consent to it. Other you could have said without the consent, but it said the informed consent means you must have briefed the donor appropriately of whatever you're going to do and the consequences of what you're going to do.
What about the recipient?
Of course, at this time, the recipient wants something. He must have been taken through the procedure of what he's going to do. The person that you're actually taking the tissue organ from is the person that actually needs to give the consent. Because the other one is the life is being saved. The person wants to be saved.